Hey guys, good evening, good evening, good evening. How's everybody doing? Do me a favor as you are coming in. Do me a favor and put in the chat. I see Monica's from, is that Oxnard? I've never heard of that. Do me a favor, guys, as y'all are coming in. Do me a favor and put down in the chat where you are watching from. I am actually streaming on YouTube as well as on Facebook. So do me a favor, guys, as y'all coming in. Just let me know. Y'all know the routine. Deidre, you know the routine. Deidre's always on here. Let me know as y'all come in. Let me know where you watching from. Deidre's in Orlando. Where's Oxnard, Monica? I've never heard of. Is that Oxnard or Oxnard? Let me know what that is. I've never heard of that. Let me know where you guys are watching from. Hey, Soraya. Soraya is one of my regulars. She said, I'm nervous with my test next Tuesday. Soraya, we definitely want to talk about that. But you should have gotten an email and gotten access to the course. So if you have not gotten it, email me and let me know. Hey guys, I see Connecticut, I see Tennessee, California, New Jersey, Houston, Texas. Hey, Anitra from Indiana. Listen, y'all, let me know where you're watching from. Continue to drop that. I'm going to go ahead and get into this tonight because I don't want to keep y'all too long tonight, but I am so excited, y'all. Let me get into, first of all, let me introduce myself and then I'm going to get into tonight. So for those of y'all that don't know me, let me just share my screen really quickly because it may be some of you guys that don't know me. So for those of you that don't know, I have been a medical assistant since 2004 and I've been an instructor since 2011, okay? Now, my number one job, though, is mommy. So that's my number one job. That's my daughter there. She's 18, about to be 19. I'm also an author and I'm an entrepreneur. I've written 4 books. Okay. I'm also an entrepreneur. Some of the things that I sell, a lot of things, but for the purpose of this channel, we just stick to the medical assistant stuff. So I got t-shirts, mugs, all that good stuff. This is probably my best selling thing right here. The stethoscope necklace. You can customize it. These are some of the things that I sell. Another thing, guys, y'all already know, if you are trying to pass certification. So if anybody happens to be watching right now, and you are preparing for certification, y'all know I got an online study guide. So if you're taking the CCMA, the RMA, any of the medical assistant certifications, make sure you guys go to marefreshercourse.com, okay? marefreshercourse.com. All right. And let me come back to the screen so I can show myself. Look, y'all are representing tonight. It's already 31 of y'all watching right now. So listen, y'all. Thank you, Khadidra. Thank you. I'll tell her you said so. So listen, y'all. We want to get into tonight. Let me bring up my notes because I don't even want to mess up nothing that I asked tonight, but I am super, super excited. Okay. The reason why, thank you, Soraya. I got to put this on the screen. Thank you so much, Soraya. I am super, super excited tonight because I feel like since I started this channel, I have been raving about my friend Lisa because we literally started out together as medical assistants. Okay. Back in 2006, we started working together as medical assistants, and she is now a nurse practitioner, y'all. So she went from working up patients, getting them ready for the doctor, to actually seeing patients herself. So I'm about to bring her on the screen, and I need y'all know how we do. Put some stethoscopes in the chat, y'all. Put some stethoscopes in the chat and help me welcome Lisa to the chat. Y'all, my regulars, y'all know how we do here. Put some stethoscopes in the chat. And Lisa, can you see the chat?
Yeah, but at the same time, I think when I pull up the chat, I can't see the video.
Oh,
but
gotcha.
I can
Okay.
see the chat. I can.
Gotcha. Okay. Okay. I see the stethoscopes coming up. Okay. I see one of my students here, Khaleesi. That's Jasmine. I see hey Jockey. I see some of my regulars here. Taylor, listen, they putting stethoscopes in the chat. That's how we welcome our guests here. We just put stethoscopes in the chat. We gotta represent.
I like that.
Yeah. Me and Lisa started together. So first of all, I'm gonna tell how we met, what you did to me when we first met.
Oh yes, please do.
So listen, y'all, it's 2006, right? We working at Unity Healthcare in DC. It's Lisa's first day. And this girl, they introduced her to me. She didn't just say hi. This girl was it a stamp or was it a pen?
It was a stamp.
It was a stamp. This girl took a stamp and stamped me, y'all. Listen, y'all. She did not know me. We just met. She took a stamp and stamped my arm and ran. Like, who does that? So that was like the beginning of our friendship. And that's what it consisted of. Just us having fun, laughing. Like Lisa literally brought the little kid out of me whenever we were together. And I gotta shout out honestly, because honestly, you are the reason that Lisa is on here today. So honestly commented the other day, and I
Oh,
said,
yes.
and I told honestly, I said, I'm gonna take a screenshot of this and send this to Lisa. Because I said
Mhm,
we gotta get her on
mhm,
here.
mhm.
But Lisa, I need to stop talking. I'm just so excited, y'all. Y'all gonna see my gums a lot tonight because I'm excited. But and then look at Coach. So Breon, that's my that is my male version of you, him. We were
Oh,
teaching
wow.
together. Yes, that's my male version of you, literally. We was teaching together. So he literally is like, he brings a little kid out of me too. So all right, y'all, we're gonna get into this. Let me hide this comment. So Lisa, thank you so much. Thank you so much for coming on here.
No problem. No problem.
Thank you so much. Can you just introduce yourself and tell, well, I introduced you, but hold on, let me get to my questions. I made a note of questions that I'm going to ask you.
Okay.
So first of all, Lisa, again, thank you for coming on here. Since I started this channel, I've been talking about you because a lot of my students that I get, my actual students that I get at school, they always say they want to get into nursing. Some of
Hmm.
them say they also want to go up to nurse practitioner. So I literally always talk to my students about you. I talk to my YouTube people about you. So I'm just so grateful that you're here. That's why I'm so excited, because it's been a long time coming. But okay, let me stop talking. Can you introduce yourself and let us know how you got in? Tell us who you are first of all. Let me be quiet.
So, so my name is Lisa Parker. Anyway, so right now I am a nurse practitioner, and currently I'm working with interventional pain management. So
And
that's my specialty right now.
okay, thank you for sharing that. So let me ask you this: how did you get into healthcare from the beginning? Like, did you know as a kid you were going to get into healthcare?
Yeah, my mom was a nurse, and then my
Mm-hmm.
sister, who's like 10 years older than me. So even before I left high school, she had already finished her nursing degree, and I kind of knew that it was something that I wanted to do.
Got you. I
I, yeah,
forgot.
I
I
don't think I had
forgot.
any other career choice. It was literally just that.
I forgot your mom is. I forgot all about that. That's why I say you ain't had no choice, because big
Yeah,
sis and mom
this
was like,
wasn't, and yeah, and my sister was
yeah.
already a nurse, and I was like, okay, that's great. I'm gonna.
And then one other thing I wanted to ask you about. So I know you were in the military. So Soraya asked, did you skip over to MP? No, we're gonna talk about that, Soraya. She went to RN and then MP. So we're gonna talk about
Right.
that. But so I know you were in the military. So can you tell us a little bit about what types of things you did in the military?
So when I went to the military, I went in the Navy as a hospital corpsman.
Okay,
They call them medics, maybe in like the Army and in the
got
Marines,
you.
they might be called medics. But basically,
Hmm.
they're medical assistants. So,
Okay,
you do boot camp and then you go to like a school that's supposed to teach you quick, fast, and dirty
got
wartime
you.
triage kind of medical stuff.
Hmm. Yeah.
It's not really a certification, so there's no bridging. There's no way for you to come out as a corpsman and then go
Hmm.
straight to nursing.
Got
Um,
you.
yeah.
Okay. Got you. Okay. So did you know that you was, so I knew that you knew you was gonna get into healthcare. Did you know that you was gonna end up being a nurse, or did you like kind of decide that while you were a medical assistant?
Um, I think I decided that that's a good question, because I want to say my goal was always to be a nurse, but I really didn't know how I was going to get there. So even just being a
Okay.
medical assistant, I was super happy at that period in my life. I was
Yeah.
happy in my
Uh-huh.
scrubs. I was
Hmm.
proud.
Right.
I was feeling myself as an
Well,
MA.
we was
So
young. Yes.
yeah, so mm,
And let me
yeah.
tell y'all, Lisa, me and Lisa, y'all, we used to get in trouble because the nurses, it was two nurses. They couldn't stand us. They could not stand us. I don't know if we was too silly or full of ourselves. Like, what you think it was, Lisa? Because they could not
I
stand
think
us.
it's just joy, because I still get
Yeah.
that now because I'm like
Uh-huh.
a younger provider. So
Yeah.
even when I walk into rooms now, it's like, who does she think she is? And
Mm,
giggling. I don't have no stress. I'm just hee hee hee.
yeah.
And they probably like, who does she think she is? Like, look at it. They think it was handed to me. I guess it might
Right.
be a little
Right.
bit of that. I
And
don't know.
they don't see how many hours you put in. Because outside of school, I mean, just your work as an inmate, because we were working together at least for 4 years. I can't remember if I left first
Yeah.
or you left first.
I think I left first, and then maybe like
Okay.
a couple weeks later, you was like, "Oh, girl, I'm leaving too."
Yeah, I could not. When I tell y'all, like me and Lisa was like literally two peas in a pod. Like I could not do that without her. Like we was literally, I mean, outside of work too. Like Lisa was at my house. We was going out. I mean, like we were like genuinely friends outside of work. And so it wasn't it there's no way that I don't think either one of us could have worked there without the other one. Cause it was like even when I started, even though I started first, I think I was only there like 2 months before you got there. And then when
Oh,
you got
wow,
there, yeah,
really?
remember I was kind of fairly new. I remember I trained
You
you, but
were.
your niece had
Yeah.
trained me.
Yep,
Your
yep,
niece
yep,
had
yep.
recently. So literally, it was both 2006, but just a
Yep.
few months apart. So it was like I couldn't even imagine being there without you.
Oh,
Um,
same, same. That was probably the peak of my work career.
I know we had so much fun. Listen, y'all, we worked at Unity Healthcare together. And for those of you that don't know, Unity Healthcare is a big organization in DC. And there's so many different offices. Like I tell my Anova coworkers, because Anova is in Virginia, I always tell them like Unity is the Anova of DC. Like
Right.
we were everywhere. And so we had different specialties like we had GYN, we had OBGYN, we had family practice, we had what else? We had pediatrics, whatever
I think they
practice we
had
had.
psych on the next floor, and then they had like a dental office on. I mean, it was a
Hmm.
one-stop shop.
Yeah,
Yeah.
podiatry.
Mm-hmm.
And speaking of those specialties, so before we get into to your nursing career, like as a medical assistant, what was your favorite specialty when you were working as a medical assistant?
Oh, it was definitely with you at Unity. I think I left Unity as a medical assistant. What would you call that? Just like family practice, right? We saw
Yeah,
everything
yeah.
from newborns to geriatrics, family practice. So I loved that. I think I had left and I went to another hospital into OBGYN.
Oh, okay, okay, got you. Okay. I'm just thinking about so many
Yeah,
funny stuff right now. Like,
OBGYN was cool, but I didn't like it as much as, family practice. I liked family
got you.
practice.
Yeah,
Yeah.
I think so. So, what would you say is like your least favorite? Like, out of all the specialties that you worked in, not into the nursing part yet, but like as when you were still in MA, like what would you say? I always ask this question, but what do you say was like your least favorite?
It was probably the OBGYN. I mean, honestly, as an MA, I probably only
Mhm.
had two jobs. I stayed at Unity for quite some time. So I got out of the
Oh,
military.
that's
Yeah.
right.
So I got out of the military. My very
Hmm.
first civilian job was Unity
Hmm.
Healthcare. That was my very first job.
That's right. Yeah.
Yeah. And then after that, I went to another hospital as a medical assistant. I didn't like it.
Okay.
Then I started applying for nursing school.
Got you. Okay. Honestly said, honestly said, y'all was in there cutting up. No, seriously, honestly.
Majorly.
Because I mean,
Majorly.
we were so young. I mean, like when I started at Unity, I was like, how old was I?
Probably
What?
like 1920.
Yeah, and I was like 21 because I'm like a year older than Lisa. I was like
Yeah.
21. So we were like super young, honestly. Like 19, 20, 21. We were super young. So we definitely was in there cutting up. Honestly said, I
Yep.
love that. Honestly, listen, you the reason she on here. I told her, I said, Lisa, I said, you need to come in here. I said, you
Yeah.
make me look bad because they probably think I'm lying. I said, I talk about you all the time. They probably think I'm lying. Um, so I want to start getting into the nursing now because a lot of people, like I mentioned, between my students and also like people that follow me on YouTube, some of my regulars here.
Yeah.
I think Soraya is one that wants to get into nursing. So how was that I guess like what kind of schooling did you have to like where did you have to start when you decided to go become an RN?
Okay, so first thing when you're deciding to be an RN is to decide,
Mm-hmm.
which degree fits your life. Do you want to get an associate's? And then that's 2 years degree, and then go to work, and then know that you probably need 2 more years after that while working.
Okay.
Or you can go straight to the BSN, the bachelor's level.
Okay.
That
So oh, I'm
Go ahead.
sorry. I'm sorry. No,
No, go
go
ahead.
ahead.
Yeah.
I'm sorry. I'm
So
sorry.
you would figure out, what do you have to commit right now? You can give 2 years right now and then go work in a hospital. And typically hospitals will cover the rest of your schooling to get you to
Okay.
the the BSN, but then you're working and you've got to
Oh,
work because that's how it works. They give you
mhm.
something, you give them something back. If you don't think that you'll be able to like manage, contractually staying on that job and going to school, that's kind of where you get into a sticky situation because they're not giving you that money for free.
Got you. Okay. So let me ask you this. How easy or difficult was that transition um from medical assistant to nursing with like schooling and stuff like that? Like
Oh,
how
it's
easy or
extremely,
difficult?
it's like two different worlds, honestly.
Okay.
Mm,
Oh, and okay, I'm sorry. Go ahead. Did I cut you off?
Medical assistant taught me vital signs, which,
She said vital
that's
signs.
very, very, very important. I mean,
Right.
to this day, if I have a patient and my medical assistant is not there, then I'll be like, okay, have a seat. I know how to use the blood pressure cuff. Like, duh. And the
Right.
doctors will run behind. They're not touching that cuff. They'll be like, I'm waiting
Yeah.
for my MA to get here.
That is so true. That is so true.
Yeah.
That is so true.
So I'll be like, just bring the patient back. I know what questions to ask. When was your when was your recent fall? I know how to do that kind of stuff. And I know how to like access systems that medical assistants learned, right? The vaccination,
Mm-hmm.
things like that. The doctors aren't really kind of aware of.
Mm-hmm.
So that's kind of beneficial is kind of
Mm-hmm.
knowing the local resources. You'll be like,
Got
oh,
you.
I know exactly where to refer this patient to. Oh, I know Unity. Oh, I know who to call. Oh,
Right.
I know to this day, Kendra, all of
Mm-hmm.
our referrals that we used to say we're sending to an eye doctor and we know that's Dr. Anderson, right?
Yeah, right.
To this day, my
Uh-huh.
patients will be like, who can you refer me to? I'm like, oh, I know. Oh,
Right.
give me an OBGYN. They're going to Auguste.
Right.
Stuff like that. And it's
Right.
memorized. It's so stuck in my head because like we did those referrals every single day.
Yes. I was, yeah.
So I think that was helpful.
So I was talking to, there's a gentleman that I was working with today. So Tuesday afternoons, I still work in the doctor's office. Only Tuesday
Yeah.
afternoons, because I teach. But on
Right.
Tuesday afternoons, I work in a cardiology office. And there's a guy there, a young man there. He's 22 and he's working as an MA, but he is pre-med. So he's going to become a doctor,
Okay.
right? And
Yeah.
I was telling him, I said, I love that you're working as an MA, because then when you become a provider, it's gonna be so beneficial to you, because, and I'm skipping ahead because I was gonna ask you this towards the end, but
Yeah.
that's literally what I was gonna ask you about how beneficial it was that you started as an MA and now working as a nurse practitioner, because now, like you said, the referrals, everything coming second nature to you because of
Yeah.
everything you did. So I hope y'all got that. So people that's thinking about that's MAs now, and y'all thinking about becoming a provider one day, whether it's nurse practitioner, PA, or actually becoming a doctor, these skills that you're doing now as a medical assistant is going to be so beneficial, because like Lisa said, the doctors are not checking blood pressure. They're not doing none of that. They're not drawing blood. They're not doing none of that. So they're going to be relying on the medical system to do all that. But it's like she know how to do it, so she don't have no problem grabbing a blood pressure cuff or drawing blood or any of that stuff that you would have done as an MA.
Right. And just having your resources because you learn so much as an MA,
Mm-hmm.
how to
Yeah.
call how to talk to pharmacy, how to request what you need. And
Mm-hmm.
yeah, it was a lot of resources that I still tap into till this day
Yeah.
from being an MA.
So when you say, so do nurses not do vital signs as much? Because I noticed you mentioned vital signs.
Oh, vital signs for nurses, absolutely in the hospital.
Okay.
Yeah. But as
Got
a
you.
nurse practitioner, I'm a provider. So
Yeah, that's true.
I sit
I
in my
just cannot
office.
get over that. I cannot, y'all listen, I cannot get over.
So
listen,
as an MP, I sit in the
listen,
office and they come and tell me, hey, your patient is ready in room 2. As a
listen.
nurse, of course.
I cannot get y'all have no idea. Y'all have no idea the type of stuff we did together. So to know she is a provider, like y'all have no, like I got some pictures that I can show you. Listen, I'm not gonna do that. I'm not gonna do that because then I got if I do that, I gotta put myself out there too. So I'm not gonna do that.
Uh-huh. Yeah.
But that is so funny to me. But yes, it's like it's. I was gonna ask you too, like some of the differences that because one of the things my students ask me that I can't answer is what are some things that I know some things that nurses do that MAs don't do, because clearly certain things are outside of our scope, right?
Right.
But what are some things? I know the referrals was one. Can you think of anything else that we were doing as medical assistants that nurses don't do?
That would probably be it. I mean, the nurses still
Okay.
have to do everything else. It's the blood draws. So if you
Okay.
learn medical assistant, it's the EKGs. The nurses still do the EKGs. Yeah, you might have a tech on the floor, but if your tech is sick and she leaves, are you able to do the EKG? If
Got
the
you.
phlebotomist is not there, you. So literally, I worked on a critical care floor
Mm-hmm.
in the hospital, and
Mm-hmm.
the policy at my hospital is that if you worked in the ICU or a critical care floor, um, what they call IV therapy is basically like a bunch of nurses. You call them and you say, "Hey, I need an IV on my patient."
Okay.
On critical care units and ICUs, you were supposed to know how to place your own IVs. This was life or death. You could not call the IV therapy and wait 30 minutes.
Mm.
It wasn't even an option. So
Got you.
I was like, oh, I used to draw blood. I know, how to do this, and I know how to place IVs. Like, these are the kind of things that I practiced as an MA where I felt confident. I didn't
Right.
necessarily know about the IVs, but then I'm not nervous with the equipment, the butterfly,
Got you. Oh,
the tubing.
mm-hmm.
That's from medical assistant.
Yeah, yeah, got you. Let me ask you this about the pandemic, because you were clearly working during the pandemic. How was that as a nurse working? Were you already a nurse practitioner during the pandemic, or were you still in the hospitals?
I was in the hospital as a nurse, but I was in school. I was in grad school during the pandemic.
And how was that being a nurse in the height of it, like when things were just like
Oh, it
really
was crazy.
bad?
Yeah,
Wow.
it's traumatizing. But it was,
Oh,
yeah, it was
wow.
absolutely, it's crazy. It was crazy.
Wow.
We
How?
went from like not knowing what it
Mhm.
was, you
Yeah.
hooked up and it's like, why are these vital signs not correcting? We're doing
Mm,
every single thing. We're doing
yeah.
you are tubed, you have a ventilator on, and we still can't get oxygen up. And then I remember like
Wow.
the doctor, he's like, I heard about this, thing. And then it just kind of blew up from there. So
Hmm.
yeah, the first couple of weeks we didn't even know what it was.
Right. Right. I remember that. Did you ever have like because I was seeing like a bunch of videos of like nurses that was like literally walking out and some of them were like literally like I can't do this no more. Like did you ever have moments like that when you were thinking like dang, I cannot, this is too much?
Not for me, but I did have
Okay.
coworkers who left,
Okay.
coworkers with newborns,
Mm.
coworkers who lived with elderly parents who were already
Mm-hmm.
compromised, and they figured it wasn't worth the risk to bring that stuff home. So they had to
Mm-hmm.
make those hard decisions and say, I gotta leave because I can't risk, doing this to my baby or
Right.
my mom.
Yeah, okay, got you, got you. Now, when you were, I'm probably kind of skipping ahead too. I don't know, my phone keep timing out.
Oh, really?
But
Oh.
no, this I got my note, I got my questions right here on my phone, but it keeps timing out. I'm trying to stay on track. I was going to ask you. Let me see, where was I at? Y'all, normally I don't have most of the time I just be asking questions off the top of my head, but these are specific questions that I have written down because I know they're gonna want to know that. They
Okay.
want to know this stuff. Another thing that I was going to ask you about was your so I know I heard your decision to go from MA to nursing. What made you decide to go all the way to nurse practitioner and become a actual provider?
Um, Honestly, when I don't know what it is, but you kind of get bored, right? But
Uh-huh.
it's crazy because you can never, ever, ever get bored in medicine. You can never know it all. You think you do, but I was
Mm-hmm.
bored as a nurse, and so I was like, I need something a little bit more challenging, and I want to make my
Mm.
calls, and I want to manage my own patients, and I want to do the whole education bit, and
Okay.
what led me to, go back to school.
You sound so nonchalant about it. Let me go be a provider. Like you sound like, let me just go back and go back to school.
No, it wasn't. I mean, I was the nurse for 6 years.
Yeah.
So, and I started off critical care. Everyone said you had to go to med surge, and I was like, not really. I want challenging things to do. So after
Mm.
6 years of critical care, Um, yeah, I figured I would do more challenging things. Like I can learn more. Let's go back to school.
How challenging was it when you were in school, like nursing, working as a nurse, and then being in school as a for nurse practitioner?
Ooh, let's see. So I ended up, oh, Jesus. So I ended up like not working during the week and only working on the weekends. That was
Wow.
my hospital actually had a program for nurses who only worked the weekend.
Oh, gotcha.
So I only worked the weekend every
Wow.
weekend for like
Really?
2 years.
Wow. Wow.
So every party, every get together, every, you know, I think my sister delivered her baby on a weekend. I was like, what the girl? Like, you couldn't have picked the Monday, Tuesday,
Right.
Wednesday.
Right.
But so every weekend was gone for 2 years.
Wow.
Weddings, family trips, let's just
Mm-hmm.
get away for a weekend. I can't. If Christmas fell on the weekend, so be it. Like, I had to do it. So that's like one of the sacrifices that I had to make in order to get through schooling.
Wow.
Are you frozen?
Yeah. And I'm glad you mentioned that because I have heard. Oh, am I frozen?
No, no,
Am
no,
I
no, no, no,
frozen?
no,
Oh
no, no, no.
no. Oh look,
Hey,
Nidra is in the
Lisa.
comments. Nidra said, Lisa, hey Nidra. Nidra was another one of our co-workers we used to cut up with. We got pictures with
Yes.
Nidra too.
Oh, Nidra.
Um, what was I dang it, what was I asking you? Oh, the schooling. Hold on. I forgot what I was about to ask you. It was something to what you just said about the schooling. Oh, I was gonna say, that's I do hear a lot of nurses say that like when you preparing like for nursing school, like you have to really like sacrifice. Like it's going to be a lot of things that you're going to miss,
Yeah.
a lot of sacrifices that you're going to have to make. So I'm glad you mentioned that. And so hopefully y'all that are listening, that yeah, Elle said dedication indeed. So hopefully y'all that are listening, like really get that you are gonna have like 2 years, nothing. Like that's a big sacrifice. Like nothing on the
Mhm.
weekends at all,
Nope. 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 Nope.
except working.
Yeah.
Um Smiling Sense says, so I don't know if it's a he or she, but they said one of my nurses in my department said it's not my job to draw blood. Wow.
Yeah. What department is that?
Yes, Smiling. What department is that? Let us know what department that was.
My God. So on the floor, right? Like
Mhm.
we would fight to be known as like the person that can get blood. Oh, I can't get blood. Hey Lisa, come help me get this blood. And that was
Right.
like my super proud moment.
Right.
So
Like you like, I'm
so
coming.
people would, yeah, so people would literally like fight to draw blood to kind of like establish like, yeah, I'm an OG. Let me show you about this vein in the thumb. Like,
Right.
oh yeah, let me show you this thumb vein. Here's a little tricky trick.
Right.
And it's like, wow, thank you. So for me to be like, oh, I don't draw blood, I don't have any options, right? So I
Yeah.
couldn't say that.
Right. So how does since you work as a medical assistant, how does that influence you as a nurse practitioner? Like I know it helps you with your referrals and stuff like that, but how does it influence you in terms of like the MAs you work with and just in general, just treating your patients?
Right. So being a medical assistant,
Mm-hmm.
it teaches you other aspects of the job, right? Because
Mm-hmm.
the visit starts really at the front desk, right?
Mm-hmm.
I even go behind the front desk and be like, teach me how you check in. Because
Oh
if you're not here,
wow.
do this. Oh, show me what I'm looking for when I'm looking for insurance. You don't want to
Mm-hmm.
be in a position where somebody can't show up to work or something happens, like, you know, whatever, they're late or whatever, that you just stuck sitting there, the patient looking at
Right.
you looking at the patient. And she's like,
Right.
I'm you, but you're like, yeah, well, I need vital signs taken and I need these questions asked, and I can't do that because I don't have a medical assistant. Like, you don't want to be that person. So you want to
Right.
learn like all facets of your job to be great.
Mm-hmm. Mm-hmm.
More respect for my medical assistant, obviously. Like,
Yeah.
girl, go ahead. Like, I'm gonna clean the table. Like, like
Like, I got this,
I
girl.
can, I
Go
can
get
peel
your
a
kids.
table.
Go get. I know you gotta leave early. Go get your kids, girl.
Yeah, like I can peel a paper and Lysol down this table. Like, it's not that serious. Like, if we're running
I
behind,
love that.
just to sit there and like watch somebody struggle doesn't make sense to me.
I
So
love that.
I feel like I get that from a MA perspective. And I know that
Hmm.
certain medications I'm writing for needs a prior authorization. I make sure I have everything lined up for her, right? Because I know
Yeah.
what they're going to ask. I'm like, oh, you're going to need my NPI. You're going to need this, 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 this. Been there, done that.
Right.
Remember, referrals used to be like 80% of our jobs. Jesus.
Them daggone referrals. Oh my
And
goodness.
getting them authorized. And, you know, um, yeah, so I think it really taught me respect just for everyone, right? Because it's like, oh,
Yeah.
start off here.
Yeah, yeah, I think so too. I was telling the gentleman at that today too. It's like it gives you more empathy and
Yeah,
it makes you more well-rounded because
yeah,
some doctors don't even know how to check blood pressure or draw blood or anything. So
nothing.
it's like it just makes you even more well-rounded.
Yep, yep.
So I'm wondering too, like, what are some of the things that you look for in an MA? So as a nurse practitioner, like if you had to hire a new MA today, what are some of the things you look for in a medical assistant?
I like, so I have a great medical assistant now, but she's actually there before I got there. So,
Okay.
but, and I don't hire anyone, but, so they come with they come with the hospital. So
Gotcha.
whatever.
Okay.
But anyway, she's like really good because she's always on time and she always like thinks ahead if there's going to be a procedure done, like the medication's there. She has like little packs that's like already pre-set up. Um,
Mm-hmm.
she does prior auths like super quick. Like she has, I don't know if these things are like pre-populated or what, but I'm like,
Mm-hmm.
what? Like how? So she just does things without anyone having to ask her for it.
I
And then
love it.
if we get messages in our box and she sees that like me or another provider doesn't answer the message,
Mm-hmm.
she literally like prints out the message and then drops it on our desk and she's like, you're going to address this today.
So she holds you accountable. She
Yeah,
keeps you on
she
your
was like,
toes.
so she is like on point. So our patients are always like, this office always calls us back, and it's really because of her. Because the
Wow.
messages that get skipped, or I might read it and say I'm gonna get back to that, but then I don't. Tomorrow is Wednesday. She's gonna print out every single missed message and be like,
Re-
you're gonna address this today.
I love that. Do you
Yeah.
ever run into patients from Unity that we had at Unity?
Unity's network is so large.
Mm-hmm.
Every single one of my patients, if they're not in the system that I am in now, they are
Mm-hmm.
Unity patients, point blank
Oh,
period.
okay, got you.
Some of the residents I work with, after they left the hospital and they go find
Mm-hmm.
jobs, they went to Unity. Um,
Okay,
so that's another connection to Unity. And
got you.
yeah, a lot of people actually came out of Unity. Insurance, I've been to like,
Mm-hmm.
medical dinners and conferences, and they'll be like, hey, I remember you from such and such. And I'm like, oh,
Really?
very seriously. Like,
Do,
I'm like, what?
do you
Yeah.
ever do you ever have days where you can't believe like where you are now? So like thinking about starting back even before medical assistant as a corpsman, do you ever have days where you sit back and like, I'm really a provider?
Oh, yeah. Almost every day. I'm like, I can't believe I did that.
How was it when you first became a nurse practitioner? Because you went from rooming patients and getting them ready for the doctor to actually seeing the patients. How was that transition into like, oh shoot, it's me. I made the decisions now. How
Yeah.
was that?
It's really hard because,
Okay.
the medical assistant kind of got me in a cushy role. And even as a nurse, even as an RN,
Hmm.
I got a cushy role where I didn't really have to think too hard, right? Because I know I had a provider to back, like, ping ideas off of and like, hey,
Yeah.
final call is yours, brother.
Right.
Now it's a whole new ball game. And every single day I go, like down my patient's list in my head and I like go over every note, go over
Hmm.
every x-ray, and then I'm like, okay, what else is another call I could have made? Always
Hmm.
having like plan A, plan B, plan C.
Got you.
Um Yeah, so it's just a lot more. I would say it's actually a lot more stressful because you just don't want to make the wrong call, right? There's like a million ways to skin a cat, but you want to make the right call the first time.
Yeah, because no pressure, no pressure, but you literally have people's lives in your hand. Like
Yeah, like no
literally.
pressure. Yeah. Is this medication that I'm prescribing, contraindicated with the other 30 medications they're on?
Right. Right.
Is
Right.
the allergy list that is like, you know, lengthy, is what I'm prescribing has some component of that allergy? Like, I-
Right.
yeah.
Yeah.
So it's yeah.
I can't
Like,
imagine. I can't imagine, Lisa. I can't imagine. Like, oh my goodness. I can't imagine like having like making the decision. But what you just said, it goes back to medical assistance and making sure we doing our due diligence on our end. That's one of the things I stress to my students and I stress to like my YouTube people that follow me on here. To make sure that you are verifying medications at every single visit, because
yes.
just what you said,
Yep.
contraindications and all of that,
Yep.
if you don't get an accurate list, how does the
Yep.
provider know that they can prescribe a certain medication if you're
Yep.
not verifying their allergies? Lisa, I had a patient who literally was just at the office maybe like a few days before that, and guess what, he had just had a medication change earlier that day by another provider. So if
Mm.
I would have just left it there, oh, he was here a few
Yeah.
days ago, it's the same,
Yep.
I would
Yep.
have missed that new medication. So you verify, y'all that's listening, you verify those medications every single time, allergies, history, all of that.
Yep.
Because
Yep. Yep.
the
That's another thing that I really like my MA about. Sometimes
mm-hmm.
it's taking her 5, 10 minutes because they'll be like, I don't know the name. She'll be like, look it up. She'll be like, I'll wait. Log into whatever you need to log into. Call your mother. Tell them send a picture. Like, and she
Mm-hmm.
don't play. She'll be like, I want that medication list. So I
Right,
know by
right.
the time she's done, it's accurate.
She sound like she don't play.
She don't.
She sound like she don't play.
I'm in the room 30 minutes talking, like wrap it.
Uh-huh.
She'll come and knock at the door and be like, wrap it up.
I
So
was just about to ask you if you are I was trying to think a couple of the other doctors that like, are you a Dr. Augusti or are you a Dr. Corbett?
what does that mean? Like
So
slow or
Augusti,
like
Augusti was, remember how Augusti, she was fast, she was in and out.
yeah,
Dr.
yeah,
Corbett, we're gonna need this, and she was extensive. She would be in the room for a while and she need a whole bunch of stuff.
yeah. I think it was probably because she was new. When you're new, you just like I said, like I'm doing this like rehearsal thing in my head. It's like
Mm-hmm.
10 times. I'm asking the HBI 10 times.
Mm-hmm.
I'm
Got
asking
you.
your medication like 10 times. Whereas, someone who's well seasoned, I sometimes I go in the room with my doctor and I'll be like, oh, this is what I learned on the patient. He comes in 2 minutes and he gets like pertinent details and shit stuff that I missed. And I'd be like, how? How? But he's
Right.
just that good. He's been doing it for
Yeah.
30 years. And
Right. Right.
yeah. So
Right.
in the beginning, very slow because you're just like, am I missing something? Am I missing
Mm-hmm.
something? Am I missing
Yeah.
something? Yeah.
Yeah. So I remember how it was. I think when Dr. Dan you first started, I think she was like fresh out of school when she first started. And I remember
Yeah.
that you're right, you do notice a difference between the newer doctors versus the older ones. Because the newer
Yeah.
ones, they trying to cover everything. They trying to make sure like it would take a long time. Like
Mm-hmm.
patients would be
Mm-hmm.
waiting and stuff like that. So that is
Yep.
such a good point.
Yep.
And
Yep.
hey guys, let me know if you guys have questions, go ahead and leave it. I'm gonna start addressing some of these questions in the comments. I put the call-in link in the chat. I'm gonna put it in the chat. Soraya, you still here? What'd you
Let
say?
me the questions.
Yes, we about to answer some of these questions. I'm gonna put the call-in link. Sometimes Lisa, they call in with their questions. Soraya, she's watching. Look at Tiffany. Tiffany's on it. Hey, Tiffany. Tiffany is another one of our coworkers we
Hey,
just cut up with.
Tiff.
Listen, y'all, we was our little crew at Unity. Listen, cutting up. We were something else back then. Call in link. I'm gonna put it in the chat. If anybody wants to call in, you don't have to come on camera. You can just ask your questions. So I just put the link in the chat. And Lisa, before we start taking these questions, I wanted to ask you one last thing about oh no, two things actually. I wanted to know do your students, I mean, do your like your coworker and stuff, do they know you were an MA? You started as
Oh
an MA?
yeah. Oh
Oh, so
yeah.
your MA now? Okay,
Yeah.
okay.
Oh yeah.
And I was going to ask you too. So for people that's watching, so we got like Soraya here. There's a few more people that want to be a nurse. They are medical. They are either already working as a medical assistant or
Right.
they're just about to get into school. So I was going to ask you if you could give them some advice, like what would you tell them? They looking at you right now and they like, look, I want to do that. I want to become an MA and then I want to go all the way up to nurse practitioner.
Right.
Well, let's start at nursing first. Let's start nursing. They want to be a nurse. And Soraya, I see you backstage. I'm gonna bring you up in a second. But if they say I want to be a nurse, so start there. Like, what would you tell them? And then the ones that want to go all the way up to nurse practitioner, like, what would you tell them?
You just got to be dedicated. That's the number one thing. You got to be
Okay.
dedicated. The hours of studying is going to be very long. And then you're not studying for memory. So you want to really understand the pathway. And they always
Mm-hmm.
say if you can't explain a concept to a 5-year-old, that means you don't know it.
Mm-hmm. Wow.
So study, study, study. Just know that like life is not going to be the same when you're in nursing school. And that's just a sacrifice you got to make.
Yeah.
And yeah. And then you got to really learn the material and not just like pump and dump it.
Right. Right. Got you. And then going from if they say I want to go all the way to a provider, like same thing, like
Yeah.
make sure. Yeah.
Thing your study hours are going to be crazy. You got to have a great
Mm-hmm.
support system. You got to figure out how you're going to balance work if you are
Mm-hmm.
working, because they're going to tell you over and over and over again in nursing school you cannot work.
Mm.
Mm.
I was
But
going to ask you about that too.
yeah, clinicals are during the day. You're going to the
Mm-hmm.
homes to take care of patients during the day. You're going to peds clinic to do your rotation during the day. And that can be Monday, Wednesday, Friday this semester. Next semester,
Mm-hmm.
Tuesday, Thursday. And usually people don't have that kind of flexibility with their jobs to be like, oh,
Mm-hmm.
I just come in on Tuesday. They're like, no. So
Right.
they usually tell you, don't work. And then you're up all night studying after class because class is from like 8 to 4. So
Okay.
at 5 and you make yourself a meal. Starting at 6, from like 6 to 12, you probably need to be studying.
Yeah.
So
Got you.
like
Got you.
nighttime gig either. Some people work.
Mm-hmm.
I did have a guy, he was a bartender at night
Mm-hmm.
during nursing school, but he would like cry every day. He'd like, man,
Oh
this
my
is
goodness.
rough. This is rough.
I cannot imagine. Oh wow.
Yeah, it can be done, but I mean, just make your life easier. Just know that.
Prepare for it. Prepare
Yeah.
for it. I hope y'all heard that. I'm gonna bring Soraya up. Soraya always calls and she's one of my regulars. She's always on here every time I go live. And I always count on her. She always has a question. What's up, Soraya?
Hi, Miss K. Hi, Lisa.
Hi,
Hi.
hi.
Hi. So one of my questions is that Miss K, I want to just correct you a little bit about this, but this is my
Okay.
first time being in the healthcare industry. So I'm taking
Oh,
my NHA next week, and everyone's
okay.
saying, "Oh, go to RN." Sorry, that's my baby in the back. But
It's okay.
I want to just do MA, then
Oh, okay.
get my feet wet to see if I like the healthcare industry. Then I'm thinking about doing LPN. Everyone keeps saying it doesn't make sense, just go straight to RN. I know RN makes good money, but sometimes I do care about my mental health as well. And I do hear that RNs, your mental health is all over the place. So my question is that is it really worth it as an RN besides LPN, or how does someone know what would be a good fit for them, LPN or RN, or to just stay whatever they're comfortable with?
Ooh, I think that that's a difficult question for me to answer for you. Like you said, you kind of have to you'd have to know about the mental stress and load that you are willing to take on. Some people getting the 1,000 piece puzzles. Some people just want the 6 piece, get it done and out the way, and they both enjoy the puzzle, right? But some
Yeah.
people want a challenge, and then some people are like, it's done, it's okay. I don't need to do this hard puzzle to prove anything.
Mm-hmm.
So I would take a look, depending on where you live, where LPNs work versus where RNs work. We didn't have LPNs at my hospital.
Mm.
None.
Oh.
Zero. And really the DC area is kind of like that, Kendra. The
Mhm.
LPNs are in there. They're running the nursing homes. They're the head charge
Oh.
in nursing.
Okay.
So right now they have patient care techs.
Okay. Yeah.
And I think that's like a mix between,
Mhm.
CNA, MA. They have like a certification for that, but I really think it's
Gotcha.
probably CNA certification
Yeah. Yeah.
in the hospital. Then you have your RNs, and then you have your residents and your doctors, but there's no in between LPN. There's no,
Oh.
in my hospital they said that there's no need for that, right?
Yeah.
You've got two people who can clean. We've got the nurse and we've got the
Yeah.
tech.
Wow.
We've got people who can pass medications, so
Mm-hmm.
it would kind of be like a duplicate thing. So I would look into where you live and see where can LPNs work. Are they working in the hospitals? Are they working in nursing homes? And then if you're happy with, doing the nursing home shift, what are their hours typically like? Nurses are 3 days a week. LPNs
That's
might not be 3 days a week.
yeah. That's actually good to know, Lisa, and that's probably why. Um, this is probably why there's this thing going around that LPNs are phasing out. And I don't
Yeah.
think that they're necessarily phasing out. I think it's exactly what you said. They're not in the hospitals where you would think, like if a medical, one
Yeah.
of my students right now tell me that they want to go work in a hospital, I would tell them to go become an RN because, like you said, the
Yeah.
LPNs, you don't really see them in a hospital.
Right.
One
Right.
of my students, she decided to go become an LPN because she just wanted to be able to get Botox injections. She works at an esthetician office. And
Yeah.
in order
Yeah.
to get Botox, she had to get LPN. So for her, it
Yeah.
made sense to just do that. So I love that advice. I think I love that, Soraya. So try to think about like where you want to work and then go from there. And either way, it's going to be challenging with going to nursing school because LPN, they still have to do everything like the clinicals and
Yep.
stuff like
Yep.
that. And
Yep. Yep.
yeah. You there, Soraya?
Thank you. Yes, I'm here. Oh, this for my son. Thank you so much.
Okay, got you. And I'm sorry, Soraya. I don't know why I thought I got you mixed up with somebody else. I thought you were one of the ones that was trying to go straight to nursing.
No, I'm still trying to figure it out.
I got you. Well, I'm glad you're here. I'm glad you're here every day because the fact that you're here every day, soaking up knowledge, is just
Mm-hmm.
letting me know how passionate you are about this field and you're trying to learn everything you can. So thank you for always coming on.
Thank you. And I did get the guide. I did get it. I appreciate it. Thank you.
Okay, good. Okay. See you later, Soraya. That is such a good point, Lisa, and that explains why people think that they're phasing out because you don't. Do you think they a lot of times in a doctor's office too, like not necessarily in the hospital, maybe they're just in the office, kind of like who our nurses were. I ain't gonna say no names.
Yeah,
They're
but
like
then when
that.
you think about it, what were their purpose?
What we couldn't do, they were literally doing just like remember we couldn't give so like you're
Oh, the
because
insulin.
yeah,
Uh,
so yeah,
Okay,
we couldn't do insulin, and then if they needed like clonidine for their blood pressure, we couldn't do that. So it was
gotcha.
like they were
Yeah,
doing that, but you're right, it wasn't like a whole lot of other stuff. I think Miss Stephanie was the only RN and she was
right.
the nurse manager. So yeah, you're right. It wasn't a whole lot of need for
Yeah,
yeah, besides the insulin thing and then some of the medications. I think if the
yeah.
patient needed Tylenol, I think we could give that, but we couldn't give insulin or
Clonidine.
clonidine. Yeah.
Yeah, that makes sense. Yeah, yeah. Nice.
We're going to start answering some of these questions here. Let me see. I'm scrolling back up so I can kind of go in order. Oh,
Yeah.
we already answered that. If you say anything too, Lisa, let me know if you want to see. I'm
Let
trying to
me
go back
see.
up in order.
Oh, does it go away when they go too far? Oh no.
No, it doesn't go. Oh, this is a question for you. Were you working as an NA while you were in nursing school?
No, I was not working at all in nursing school.
Okay. Okay. Um, smiling say, smiling say, you know why I'm laughing because I'm thinking about it.
Why was
Nurse,
I not working while I was in
you want to
nursing
get into
school?
that? You don't mind sharing that?
I don't. Yeah. No,
Okay, so let's talk about why you weren't working
yeah.
while you were in nursing
I
school.
had an amazing support system. My ex-boyfriend
Mhm.
at the time, uh, took care of everything. So I was able to go to nursing school with absolutely no financial burden. And mind you, I did have the GI Bill.
Oh, okay. I didn't know that. Okay, because military. Okay, I didn't know
Yeah.
that.
So most of my student loans were probably covered by, merit or something, being on honor roll. Then I had the GI Bill kicking in, and then whatever the GI Bill didn't cover, $1,000, $2, he'd pay it.
Now, are we talking? Now, are we saying like in what capacity we knew this ex-boyfriend, or are we sharing that?
No.
No. Okay.
How do we meet? I don't know.
Right. How do we? I know him as well. That's why we're laughing about it, because I know him as well, guys. So
Yeah.
don't worry about it. It's just an
Well,
insight.
too much of my business.
So Smiling says nursing is not for everyone. I thought about it, but I'm considered healthcare administrator. Okay. And that's good. So this is good. So this is why self-awareness is so important. Listen,
Yep.
everybody is not meant to go into nursing. Like
Yep.
Lisa, I was sharing with them. I went to an event, and hey Kim, I see you backstage. I'm gonna bring you up in a minute. I was sharing with them that I went to a it was what would you call it? Maybe something like a mixer. Oh, Kim left
Okay.
out. She popped up, but it was like a mixer. It was for nurses.
Mhm.
I commented, I said, hey, can MAs come too? She said, yeah, any healthcare worker could come. So I went and I shared with them how when I told them that I was a medical assistant, everybody was trying to get me to go become a nurse. Like, why you ain't a nurse? Like,
Yeah.
even one
Yeah.
lady, she kind of put her arm around me. She was like, we got to get you in nursing school. And I was telling them that I'm okay with where I'm at.
Right.
For me, just personally, me teaching, I love teaching. I love teaching medical assistant. I love teaching, and I love having my businesses on the side. I feel
Right.
like me teaching for my few hours a day and then having the other time to work on my courses that I sell, my books or whatever, that's good
Yeah.
for me. So everybody doesn't necessarily want to go do the long hours in clinicals and nursing and stuff like that. That wasn't my path. I think if anything, if I was to go back to school, I would finish my psychology degree, because
Yeah.
I have my associates and I have some of my bachelor's completed, but I got to finish it. So if I was to go back to school, I would probably finish that. But yeah, Smiling, that's true. Like, what
Yeah.
would you say to that, Lisa? Like, nursing is not
Yeah.
for everyone.
Absolutely. So I said my oldest sister's a nurse, my mom's a nurse, I became a nurse. My younger sister, she went to nursing school, hated it. She's like,
Mm-hmm,
okay, let me try respiratory therapy. Hated it.
mm-hmm. Hated
She
it.
she now has like the most rewarding job working for the government doing housing.
Mm-hmm.
Absolutely nothing medical, but she thought.
Yeah.
And then
Mm-hmm.
my niece also, she tried the nursing thing. Everybody else is a nurse. She's like, I'm going to do it too. She's
Right.
like, oh, I hate this. And then she's like, opened up her own school in Connecticut. And
What?
oh yeah, she's like the
She's
first Black, female in Connecticut that like opened up a tech school. So she is
what?
CNA stuff, Fresh Start Technical. I'm a
Yeah,
plugger.
that is
But
so good. What?
yeah, and she is not a medical assistant. She is not a nurse. She loves
Yeah.
teaching. Loves, love, love.
Yeah.
Yeah, teaching.
I love that.
So
Wow.
yeah, I see firsthand where people are like, yeah, I'm going to try the nursing because they think that it's something they have to do, must do.
Mm-hmm.
The pinnacle of nursing, like of health.
Yeah.
And then you go in and you're miserable. And that doesn't make sense. You've got to do this for 50 years.
Because we need somebody for everything. Like if
Yeah.
everybody went to become a doctor, we wouldn't have nurses. If everybody went to become nurses, we wouldn't have MAs or
Yeah.
CNAs. We all play an integral part of healthcare. So I don't like when I have a medical assistant group on Facebook, and it's about 16, little over 16,000 people in that group, right? And
Yeah.
it's a mix of people that are in school for medical assistant or already medical assistants. Some of them are already medical assistants working their way towards nursing.
Right.
And I had there's somebody like put up a post and was talking down on it, like it's a waste of time, medical assistant and all that. And I'm like, why being a medical assistant? I had to put that person out because it's like, why would you be in an MA group, first of all, and down
Yeah.
the MAs? Everybody is not meant to do everything. That's just
Yeah.
like even going down to like the environmental workers and everything. Like we need somebody for everything.
Yeah.
Even the whole business thing. I'm somebody who pushes like having multiple streams of income, but I know that everybody don't need a business. Everybody is not an entrepreneur,
Right.
because if
Yeah.
everybody was entrepreneurs, we wouldn't have people
Flex.
as the
Yeah.
assistants and all of that. So
Yeah.
everybody, find your lane and stay in it.
And it doesn't stop there because,
Yeah.
at least 3 times a week, I get asked, when am I going to doctor school? When am I going to
Yeah.
med school?
Right.
Why stop here? And the med doctors, most of the patients ask the doctors, well, why didn't you become a surgeon? It don't stop. Someone's
See?
always gonna
Y'all hear
try
that?
to tell you, oh, you need to. They tell my doctor, well, why didn't you become a surgeon? Oh,
Do
why didn't
y'all
you go
hear?
to med school? It's like that wasn't my past.
Wow. I did not see. Listen, y'all, it
Yeah,
never stops. It
it never
never
stopped.
stops.
So find what
Honest.
makes you happy, and do that. I literally had a guy that I was in nursing school with.
Mm-hmm.
He hated nursing school, dropped out of nursing school after 1 semester. We end up back literally at the same exact job, and he is the health administrator. He is
Really?
telling me, Lisa, I need your notes signed. Lisa, I
What?
need the bill completed
What?
for days. And we giggle all day long about this. Because I'm
What?
like, okay, boss.
Right.
He's more
Right.
likely to go up the VP leadership
Yeah.
chain. And I never
Mhm.
ever wanted to be the boss of anything, right?
Right. Right.
I don't want to look at audits, numbers, nothing. So you
Mhm.
have to find the pathway. If it ain't nursing, do health administration. They tell us what.
Yeah, exactly. You hear that smiling? Are you still here? I hope they're still here. I hope you heard that. Work your way up the leadership path. Like you said, some nurses don't want to do that. One of the nurses, I don't know if Suzanne is watching, but she was one of the nurse managers, but she's like, I just want to come do my stress test, do my, you know what I mean? Do my
Yep,
job. I don't want to manage nobody.
yep,
So
yep.
I get it. Honestly says it does take a where to go. It does take a passion as well as compassion. Yes, it's always sad to see people in positions that they dislike. And that's the last thing you want to do is be in a position that you don't like. Let me see. I'm gonna take a couple more questions and then this is a good one. Ale says, how did you know you were ready to become a nurse and start the process?
When did I feel ready to become a nurse? Well, everyone was telling me I should go to nursing school, right? So I don't know.
Mhm.
Maybe they saw something in me that I didn't see. Even my ex, maybe he saw something in me that I didn't see about my decision making, or um, how I actually cared or something. I don't know.
Mhm.
But after everyone's telling me, and I'm like, yeah, let's check it out. Let's see, if this is my calling. My AMP class, that's the first, like, anatomy and physiology, and
Mhm.
it was my first love. I
Wow.
love, 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 love AMP.
Wow. That's I
Love.
love that. And you always been very smart, Lisa. Like even
Oh,
as much as we used to have fun, we used to have
yeah.
a lot of fun and stuff. You were always just so smart. So I'm not even though like I'm surprised, like it's
Yeah, that
so
like,
even so I'm not surprised in that sense that you are who you are
yeah,
now, but it's just still like unbelievable because of where we came from. Like it's like just you being a prophet. Like I need
yeah.
to come up there to see myself. I need to
No,
come.
me and my other friends, and she's like manager of the ICU,
Uh-huh.
and we are so unserious, and we be like we the leaders now, like we be
Right.
making calls, but she's
Right.
very smart, very like methodical, just amazing. And then I'd be like, he came with my stuff too. I'm like, look at me, like people take me seriously.
You know how they say we the new adults now? It's like you are like
Yeah.
I'm a provider now. Like
Like I'm the new provider. Like it's me. Yeah, it's kind of
right.
crazy.
I wonder. I need to see where Dr. Daniel is because I'm still friends with her on Facebook. I need to send her this and make sure she watches so she can see where you are.
Yeah, I see her name occasionally on some of my patients' primary care, so she's still
Okay.
somewhere.
Yeah, the last I heard, I think she was maybe at
Providence.
GW. No, not Providence. I
Okay.
think Providence. It was like GW or Georgetown, something like that.
Okay.
Is it
Yeah,
possible to be a nurse MA? Oh, what were you gonna say?
yeah. No, go ahead. Yeah, is it possible to be a nurse MA? No.
Okay, I'm okay. I was gonna let you take that because I wasn't sure. I'm like, maybe it's something that I don't know.
No.
I know I seen.
You're
Oh, honest.
or
Oh,
a
go
nurse.
ahead.
Yeah, either you're an MA or you're a nurse. Yeah.
Got you. Honesty says, have you had students to shadow you yet? If so, what do you look for to consider writing them a recommendation?
Let me see. Have I had students shadowing me? No, because I usually don't like to slow down my flow. And I'm just not that confident in myself yet, right? To have um, people shadow me in my nurse practitioner role. Of course, as a nurse, every time they hired in July, every nurse got assigned a new student. So yeah,
Oh,
yeah. That's how that works. Once they do the
got
new hiring, it's like, okay, great. So these are our senior nurses, and you're
you.
train her, and someone's gonna take that one, and blah blah blah. So yeah, as a nurse, I did train, but I didn't really shadow anyone as a nurse practitioner as of yet.
Got
Letter
you.
recommendations, I've written them for secretaries, MAs. I just look for people who just do the right thing. You
Yeah.
know,
I need
leave.
a recommendation. I'm gonna get you to write me a letter recommendation.
Yeah, because it's just like, yeah, like Kendra, like I know you're gonna do the right thing. I know you're not gonna
Yeah.
like make me regret it. I know that
Right.
like you just look for people that honest, I guess is
Yeah.
the best sense of the word. People that you don't see cut corners, right?
Character. You look for good character and
Yeah.
integrity. That is
Good
so huge.
word. Yeah,
My
that
big
is
word is my
good.
big word. You heard my
Oh,
big
thank
word.
you. Mm. I'm still working.
Um, Fred says on an LVN and in the RN program, it's the same except RNs administer. What is that? ABXTVIV? I don't know what that is. And some more management classes. I'm not sure what the
Let me
ABXT
get
is, but it's a,
antibiotic, I think.
oh, is that okay?
I'm an
Yeah,
LV.
IV.
It's the
Okay.
same, except yeah. And then for Fred, where are you working right now as the LVN? Is it like a nursing home? Is it a hospital?
Let us know, Fred.
Yeah,
And then
'cause that's
Jackie is
weird.
here.
I guess
Huh?
I say because that's weird that they would have specific medications that they're saying they can't hang if they're IV qualified. There, but every single state. I have licenses in DC, Maryland, and Virginia. I do
Hmm.
different things for DC, Maryland, and Virginia.
Oh, really?
Yeah,
So
and I have
certain things you can do in one, you can't do in another.
yes, and I literally work, Maryland on Wednesday. I
Uh-huh.
got to know what I can do in Maryland on Wednesday,
Oh, wow.
and DC on Monday, and I got to know what I can do DC Monday.
Which one do you have the most like leeway? Like it's just I could do everything.
I think it's probably DC.
Oh, DC's
Probably,
just down for whatever. Hey,
yeah, you know.
hey, Jackie, I see you back there. Jackie is another one of my regulars. What's going on, Jackie? And let me know, Lisa, if you got. Oh, she done hung up. I had maybe she lost thing, but let me know if you gotta go, Lisa. I don't want to keep you too
Oh
long.
no, you're fine. Let me see what other. I'm waiting for Fred, but then anything else?
Yeah, let us know, Fred, if you still here. Hey, Amber. Okay, Jackie is back. She must have lost connection. I'm adding you now, Jackie. Hey, Jackie.
I like this. Why does it take me so long to get here?
Lisa, you
I don't know. I thought you was playing.
y'all know how long I've been trying to get Lisa on here. She talking about why am I just getting on here?
I
Y'all
thought
know
you
how
like,
often I
but
ask Lisa to come on
these are
here.
great questions. And I'm learning too.
Hey, Jackie.
Hi, how are y'all?
Good. How are you?
I'm good. I just wanted
I,
to say, first of all, Miss Kay, I've enjoyed the conversation. Miss Lisa is very inspirational.
oh,
Um, I just wanted to say, Miss Lisa, I'm just starting out. Um, I got my CMAA in April of this year. Um, and I'm just trying to figure out what path I want to go on. Um, and everything's kind of a blur right now, but you've kind of gave me some inspiration just to keep going and not to give up, and it's okay not to know exactly where you're going to go, um even if since you can't figure it out just yet. So I just wanted to say thank you all.
oh, no problem. Okay, I have a question for you.
Yes,
When
ma'am.
you're say you've chosen your career, what does your day look like? Where do you think you pull up to? Do you pull up to a clinic? Do you pull up to a nursing home? Do you pull up to a hospital? Do you pull up to a school?
I would pull up to a hospital.
Okay. And then do you want to be in the operating room, cold operating room, but you're saving lives because you need that, like you feel good, right? You're actually hands on, you're in there, you see exactly what's going on, and a life is saved? Or are you okay with med surge and you're just helping, grandpa eat his meal?
I haven't quite figured that portion out yet. Um, but I know right now what I'm doing. I don't really care for it.
Yeah.
Miss K knows I work in peds,
Oh, girl, let me tell you.
and
Get
yeah,
out of don't look. My first thing is get out of peds. I'm gonna tell you that now. Get out of peds.
Especially if you're not
Adults,
liking it, Jackie. You gotta like where you are, Jackie. So
yeah.
I know,
Adults are nice.
yeah, and you gotta be passionate. So if you work in peds, you really have to have a heart for it, because you already need patience in this field. But when you are working in peds, your patience needs to be times 10 when you're working in peds. You really have to have a heart for it. And you gotta, and whether it's peds, GYN, anywhere, you want to love what you're doing. So if you
Yeah.
are there and you are not happy, it shows in your work. It's going to show in your attitude, everything. And I know everybody don't have a choice. Some people, we don't have a choice. They got
Yeah.
to kind of do what they got to do. But if you do have a choice, I do encourage you, Jackie. And I know we talked about it a little bit, so I don't know if you're like looking or anything, but I would encourage maybe to start looking, because of the environment that you told me you're in.
yes, ma'am.
Yeah.
Yeah.
Peds is rough. Yeah.
And then with the people she working around, she's been having a hard time. That it doesn't make it any easier.
Easier. Yeah. Yeah.
Yeah. Well, Jackie, thank you for calling in.
Thank y'all. All
You
right, y'all have a
welcome.
good
Love
night.
you, Jackie.
You too.
Talk to
Love
you
you too.
soon.
Okay, bye bye.
Hey Andrea. Hey Amber. Hey Danielle. Um she said, what are you trying to do now? Listen, Danielle, I normally don't go live on my personal page from YouTube. Normally I'm only live on my YouTube channel and my medical assistant Facebook page, but because I got Lisa on here, I said I need to go live from my personal page too, because first of all, I knew like Tiffany and Nidra is on my page. I knew it was probably going to be some people that was going to hop on here from there. So I said, let me go live on my personal page, which they did. But yeah, I was just excited, and I had to go live over here on this. But normally I do this a lot. I'm live. Oh, as a matter of fact, Lisa, every day this month I've been going live for October. So MA Appreciation Week was last week, but I decided to make it the whole month. So I've
Nice. Yeah.
literally been going live every single day this month. Literally, today is the 29th. I have gone live 29 days in a row, and I got 2 more days. And
Wow.
yeah, so it's a challenge I'm doing. Just I was challenging myself, and I also wanted to just make the entire month medical assistant appreciation. So yes,
Mm-hmm.
29 days straight I've been going live.
Nice.
And normally I'm not on my personal page. Normally I'm just
Yeah.
on YouTube and my MA page. One of my old students is here. Hey Daisy, MA to radiology. I can never say radiology. Is it radiologic? Radiologic technologist. Hey
Yeah.
Daisy. So she was one of my students who she already knew. When she was in class, she already knew she was going further. She was like, I'm not going to stop here. A lot of them, they come in and they already know they want to work their way up. And then a lot of them are like the first caller, like she want to kind of get in and then see where she want to go. But Daisy was one of the ones, like she's like, listen, my next stop is radio tech. So I love that.
Oh, nice. 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 Nice.
Amber says, I started a new MA job yesterday. Congratulations, Amber, at a hospital.
Woo-hoo.
My provider is there 3 days a week, but my boss said I can come in the other 2 days and shadow a nurse practitioner if I want to. And one of the nurse practitioners agreed.
Amazing. It's
Congratulations.
amazing. That is
Congratulations.
great.
And Amber, I'm glad you made it.
That is
Janae says, thank you. Hey, y'all. I'm a new graduate of MA. Congratulations. Okay, Fred is back. Fred says part-time home health, full-time correctional nurse. Oh, worked in a skilled nursing facility, though. LVNs can only do hydration, electrolytes, blood. Oh, withdrawal via. Okay. Almost done with RN. Okay. And what state are you in, Fred? And I've seen Fred before. Welcome back, Fred. I've seen Fred's name quite a few.
Oh,
quite a few times. Where are you located, Fred? Let us know. Because you know, like you said, it varies by state. So I'm just curious to see where he is. Because that's one thing too. I want to remind y'all that every state is different. Even MA, Lisa, did you know? So you know how we can give injections and draw blood, right? I'm saying we like you still in MA, but you know when you were MA. So since I had this YouTube channel and been meeting other people, you know, MAs can give injections in New York. I didn't know that. I didn't know that in some states they cannot, because that's just something we do is in our scope. They cannot give injections.
What?
Yes, that's weird, right?
So who's giving vaccines?
I don't know. I guess maybe the nurses.
Dozens of vaccines per day for kids in
pediatrics.
Yeah.
Yes. So when she told me that, the young lady, the very first person I met from New York, when she told me that, that's when I looked into it and I noticed there were other states too. I can't remember the other ones, but it's New York, like 2 or 3 more where medical assistants cannot give injections. And that's like a main part of our job.
Yeah, that's crazy. Oh, wow.
Lisa, you want to give a quick synopsis? Amber came late and she said, would you share your stepping stone? I started nursing school in April and eventually plan to go to become a nurse practitioner.
Yeah, my stepping stone, honestly, I don't have a good answer. It just happened, right? Like I was encouraged by others, then I decided to go because I had the time. I didn't have any responsibilities, you know, like kids or parents to take care of. And then I also had my GI bill, and I was like, I can't let that go to waste because it's a use or lose situation with the GI bill, like 15 years or something. So after your discharge, you kind of have to like use it. So with all those factors into play, I decided to go ahead and do the nursing. I found that I really did enjoy nursing. Then I wanted challenging nursing. So I went to critical care. Usually people tell you, you know, start with med surg, learn the basics, learn the foundations. But I felt like I had already kind of had my foundations from school. So then after critical care, yeah, it's just a thrilling feeling to like see someone coming completely sick and then leave, you know, a couple
leaving well.
Yeah. And I'm like, wow. And I look at the residents and I'm like, wow, you did that. Like you made a series of decisions.
Yes, I love it.
Completely changed this person's life. And I'm like, yeah, I think I can do this. I can do this.
I'm about to come be your patient. Oh yeah, no, you work in pain, right? Well, I do have some pain. I do have some pain.
You can come see me for pain.
Okay, I'm gonna come see you for pain. And Lisa, if you meant, I'm sorry, Lisa, and Amber, if you meant like what? So she didn't mention just now that she started in the military. So she was doing MA work in the military, and then she started working. We worked together as MAs, and then she went to nursing school and then nurse practitioner. You forgot that key part of us working together.
Oh, yes, that is facts.
And cutting up together and going out and all of that and all of that stuff.
Wow.
Oh, you take your test tomorrow, Kayla. Kayla says I take my CCMA tomorrow. Good luck, Kayla. Let us know how you do.
Good luck.
Oh, Daisy is not playing. She's doing her master's now. What's that? Business administration, MBA. Congratulations, Daisy. Okay, yeah. Okay, Fred says he's in California. Okay.
Okay.
Hey, Omar, this is one of my friends. See, this is why I'm glad I went live on my personal page too. Omar says I'm a long-term care worker, specializing in Alzheimer's and dementia. Wow. Oh, chaplaincy and geriatrics. Wow.
That's a really hardcore field.
Yeah, wow. I remember I kind of touched on geriatrics a little bit when I worked with a doctor. It was Dr. Brown. It was what was the other doctor name? What was his name? The older guy. Do you remember his name? Remember they did house calls? It was Aisha. Remember Aisha was on here one night when I went live. Dr. Rhodes. Yes, Dr. Rhodes. So I kind of touched on geriatrics a little bit. Omar says he loves to get more insight from others. Awesome. I'm glad you're here, Omar. And then I'm going to take this one. Yes.
Let me reword. What was after RN? School. So, like, after you get your registered nurse and you get your license and then you start working, typically schools do want you to do some RN work before you go to nurse practitioner school, but it's not a hard requirement for every single school.
Got you. So
Um,
I'm looking at her question and specialized. I'm doing specialized 18-month for ADN. So what's ADN?
the associates, yeah,
Oh,
and it's some schools that will do ADN to
okay.
MSN. There are some schools that's really hardcore. They're gonna make sure you learn everything and in between. Um, yeah, I think there are some schools that you can go from ADN straight to MSN. Yeah,
Okay, gotcha. Okay, so you may need to search some in your area, Amber.
yeah,
And you know what, Lisa, I did hear there was a nurse, and I think I made a repost of it maybe somewhere on my MA page or somewhere. But there was a nurse that did say that, as you mentioned, to get the associates and let the hospital pay for it.
yeah,
You mentioned that earlier. I think that's a good path. I like that, getting the associates, and then, like she said, like either bridge or maybe allowing the hospital to pay for you to go
yeah,
further.
yeah.
So y'all, listen, please, again, if y'all could put some hand claps in the chat, my medical assistants put some stethoscopes in the chat, hand clap emojis. Let's give Lisa a hand. Y'all, we
Oh,
have been on here over an hour. That's because
oh,
this was long overdue.
true, true.
Lisa literally just said, why am I just getting on here? Why haven't I been got
Uh-huh.
on here? I've been trying to get Lisa. I started in the 2020, but I didn't really get serious until maybe 2021. And I've been trying to get her on here since then. And finally, thanks to Honestly, I gotta keep shouting
Yeah,
Honestly out, because honestly, when I was live on Saturday, told you I've been going live every day. When I was live on Saturday, Honestly said, Miss K, can you get somebody on the channel who started as an MA and worked their way up to a PA? I said, yes. I have a friend who started as an MA and she's a nurse practitioner now. I've been trying to get her on, and I literally told Honestly on that live, I said, Honestly, I'm gonna screenshot your comment and send it to her. I sent it to her, Honestly, and she said, okay. This was yesterday. And
yeah,
literally, I'm thinking we're gonna have to
that's true.
schedule it out. And Lisa was like, I'm coming on tomorrow.
Yeah, yeah,
So
yeah.
Lisa, thank you so much for coming on. Like,
No problem.
I'm so excited. I'm so glad. I'm so proud of you. Nidra, I don't know if you saw Nidra comment, but Nidra did comment earlier that she's proud of you. Like,
Oh,
I'm
hey,
so proud of
Nina.
you, because you literally, y'all don't understand the work as a medical assistant and then go to nursing school and then become a nurse practitioner. Like, you literally started, I hate to say started from the bottom, because it's like we're not the bottom. We're not the bottom, but it's
Yeah,
just one of those things where you literally like kept going. Like, you went
yeah,
from bringing patients
understood.
back,
Yeah.
working them up for the
Hmm.
provider, and now you are the provider. Now you got a medical assistant, bringing
Yep,
patients back
yep.
for you. So that is big. That is huge. And you are still young. You're not even 40 yet. Y'all, she's not even 40 yet. And she's a provider. Like y'all here, medical assistants, y'all can go work for her. Like, she's actually a provider. So that is huge. So I had to shout you out for that. Any last words or any last piece of advice on anything that you would want to leave with anybody here?
It can be done,
Mm-hmm.
right? And then I always hear people say, "Oh, it's so much effort. It's going to take so many years." Those years are going to pass by anyway. Do something with those years, right? If I looked and said, "Oh, I'm going to do 4 years nursing and then I'm going to do 2 more years," will it? Like, I would have said no. But that time is going to come and go anyway. So if you have your mind set on something that you want to do, just go for it.
That is so good. Listen, y'all, the time is going to pass anyway. So for anybody here watching now and you feel like it's the timing is going to take too long, oh, I don't have 4 years in me, I
Yeah,
don't have 6 years. Four
you do.
years are going to pass anyway. So what's going to happen 4 years later? You're going to look back and think, oh, I could have done that. I should have done
Yep,
that. The
yep,
time that's one of the best pieces of advice. The time is going to pass anyway.
yep.
Look at it like that. Lisa, thank you so much for coming on here. Y'all, I'm gonna get right in this. I will be live again tomorrow. I got 2 more days for anybody that's just joining. I've been going live on YouTube and Facebook as well. I don't do Facebook every single day, only when I'm on StreamYard. But y'all, I've been going live every single day in October, 29 days straight. After what's this? Tuesday after Thursday, when I go live one more time, y'all not gonna see me for a while. Um, Y'all not gonna see me for a while. I'm gonna take a break because talking, I talk a lot already, but
Mhm.
talking is exhausting. Like I'm literally tired from talking.
Yeah.
And I do gotta shout out Zalika because Zalika, when I very first became an instructor, she was one of my very first students. She was my first student in my first class. So
Wow.
yes, so just imagine Lisa, like I was very young, like 25. Z, we call her
Mhm.
Z. She was literally old enough to be my mom, but she was so gracious. Like she was one of the reasons why I was able to teach because I
Yeah.
felt so intimidated. Because I'm 25, 26. These women
Yeah.
are old enough to be my mom. You know what I mean? Hey,
Mhm.
Corey.
Mhm.
Um, these women are old enough to be my mom, and it was intimidating. But Z, she was like, she just respected me. She's old enough to be a mom, but she just really empowered me. She respected
Yeah.
me, and we still keep in touch to this day. And that was 2011 when I first became an instructor, and she
Oh
was one of my
wow.
very first students, and she was an A student too. I mean, excellent, all of that. So Z, oh, you know what, Z, I might gotta have you on the channel one day. She said, "Let me know when you do." Z, you know what? I gotta bring you on the channel because her class literally named me Miss K because I was trying to figure out what they were going to call me because
Oh
they were
wow.
older. Some was my age, but mostly older. And I felt weird being called Miss Fowler or just
Yeah.
being called Miss at
Yeah.
all. So one of my students,
Yeah.
she was like, "We're gonna call you Miss K. We just gonna call you Miss K." And
Yeah.
literally,
I
so
like that.
yeah.
Yeah.
Anyway, Lisa, I love you.
I love
Um,
you too.
and
Text
like
me.
I'm so proud of you. I know I already said that, but I'm just really proud of you. And like we came a long way. Like we used to do so
We
much fun
have.
stuff together. And
We
like
have.
you, like back then we were so close. You was literally like one of my best friends. Like we would talk
We
about
have.
everything. Like we done
Yes.
cried together, we laughed
Yep.
together.
Yep.
And I'm
Yep.
just so
Yep.
grateful to see where you are. And I'm glad that, despite everything that we've been through, we still push forward. Like you could have
Yeah.
gave up a long time ago and you didn't.
Yep.
So I'm just really, really really proud of you.
Oh, thank you. I'm gonna text you on the back end all the stuff. I'm not very
Okay.
good with words, but
Okay.
I love you, girl.
And mush me. I wanted to be real mushy. I want to hear all about all your feelings for me.
Oh,
Uh,
okay.
I'm playing. No, Zalika, take your phone number off here and just inbox me. Take your phone number off here.
Too late.
Dolores, I'm gonna talk about this tomorrow. So Dolores wants to know how to become an MA instructor. Don't worry, Dolores. I'm gonna go live tomorrow and talk about this. But Z, take your number off and just inbox me. Nidra said, I'm proud of you. Nidra's still hanging in there. Hey, Nidra.
Hey, Nidra. Oh, thank you, Nidra.
You know, Nidra
Where
had
you at?
another little girl. You know, Nidra have another baby.
Nidra probably worked with me.
Nidra,
She probably in my
Nidra,
hospital. Ain't you in my
Ni-
hospital, Nidra?
Nidra and Tiffany had another baby.
Oh, I know Tiffany did. Nidra, I
Yes,
was finding
Nidra
my
has another little
Instagram.
girl too.
I'm a little old. I only got Instagram.
We need to get together. We need to plan another outing.
Yeah. Yeah. Okay. Sounds good.
All right, Lisa. Thank you again. Love
Bye.
you.
Thank you,
Love
guys.
y'all.
Thank you.
I will see
Thank
y'all
you.
tomorrow. Y'all have a good night. Listen, I almost laughed so many times when I was looking. I don't know why I was just thinking about so much funny stuff.